is access to academic centers that can provide care for rare and complex work. So what I mean is, let's say there's a difficult surgical oncology case that requires a level of subspecialty care that doesn't exist in the community. Well, why would you need to fly to New York or to Boston to get that care when you can drive or fly to Tampa? The drive's 3 hours, the flight is 45 minutes. It's a wonderful city. It's an easy city to navigate. We're in the center of the city, literally. And people, and by the way, we've been doing this for over the last year, and it has been accepted really well by the people that have come here. We have navigation services, concierge services. We take care of the patient as they're coming here. We make sure they get home safely. We make sure that all the information gets back to physicians in their hometowns in Palm Beach. So it's a tightly coordinated set of activities, and you get access to world-class healthcare right across the state. And yes, you could go down south to Miami, or you could go up north, but Tampa is a very nice city. It's a city that you can easily navigate, and people have really enjoyed it. We also have 5 helicopters that traverse basically the state of Florida. So we also have an air transportation system that's extremely robust. And we've actually been over to Palm Beach more than once to pick up patients and to bring them to Tampa for life-saving care. So the reason we're here is not, look, I'll be very direct about it. We're not here to be carpetbaggers. We're not coming in like some health systems do and say, well, we're here because the healthcare in Palm Beach needs to improve and we're going to save Palm Beach County. Palm Beach County doesn't need to be saved. We have wonderful community hospitals doing wonderful work. We have outstanding physicians doing excellent work in their physician offices and in their surgery centers and clinics. What you lack, though, is access to academic medicine for rare and complex care. And that's what we're offering, and that's why we're there. Our goal over the next several years is to grow our base of 20 physicians that we currently have, or 20 providers, doctors and advanced practice providers, to 100, and potentially over 100. So we're here to stay. We're proud to be part of the community in Palm Beach. We're proud to be members of this chamber, and we're delighted to be here with you today to not only share a little bit about who we are and why we're here, but I want to now pivot over to Jason Wilson. Jason is a very modest guy, but Jason's been, in a lot of cases, the face of COVID for not just Tampa general, but for the whole state of Florida. Because the type of institution that we are, I mean, we train 700 residents and fellows a year. The type of hospital that we are, or health system we are Florida's health system. We take care of patients from all around this great state. So Jason's been the face of COVID for us, both at the state level, but he's also been the face at a national level. He gets pulled by CNN, by Fox, and by stations from around the country and globe to really talk about what's happening with COVID in the state of Florida. And he's here to share some of some of that knowledge and wisdom with you. And then once he's done, we're here to answer any questions and engage you in any dialogue that you would like. And with that, I will turn it over to Jason.
Well, thank you so much, John, and thanks to the Chamber for having us. And I really appreciate the opportunity to share some stories about COVID and where we're at right now. And this is from the perspective of a frontline emergency medicine physician. You know, I'll go in tonight and see a lot of patients with COVID, but it's also from the perspective of somebody who helps John stand up operations in our hospital to treat and see COVID patients safely, and then also how we can do research, you know, in an innovative place like Tampa General to develop new therapeutics for COVID patients. So that's the perspective I'm bringing to you. And I want to start it, you know, as time goes on, you start to look back on some key events And then, I know everybody kind of makes these jokes and memes on social media. There's like pre-pandemic world, and then like what day of the pandemic is it, or what year is this now? It's just pandemic year. But now I am starting to see some events and some structure to time. And I always start with this story of a Sunday night. It's the first Sunday in March, and I'm working a clinical emergency medicine shift. And it's a pretty ho-hum shift. I'm actually in the fast track area. So I've got a couple of nurse practitioners and PAs who are working closely with me. And we're seeing your, standard ankle sprains and coughs and colds and flus and those types of things. And I look around, and our head infectious disease hospital epidemiologist, who now John's gotten to know very well, and we both have gotten to know very well, Dr. Sita Lakshmi, who's running our new COVID hospital essentially. But she shows up at about 9:30 at night on a Sunday night in the middle of my clinical shift. So I just want to paint that picture. It's like a movie, right? It's never good when the ER doctor is working nights and the infectious disease doctor walks in and says, Dr. Wilson, Jason, she's a very humble, very, very proper person when you first meet her. Dr. Wilson, I think we need to have a discussion, she says to me. I say, oh, okay, let's go to my office. And that's a joke in emergency medicine. Your office during a busy shift is usually the break room, or the nourishment room where the graham crackers are. So we walk in, and she tells me this, very concerning story that COVID is here. COVID is in Florida. We've got some, cases of COVID in the area, and we really need to get serious about standing up an operational response. And so really in my head, March 1st is kind of day one. I know we had heard about COVID in the media, getting here to Florida, likelihood of it coming was high, but, it hit me on March 1st in that conversation. And I really will say after March 1st that day, it was, all hands on deck at our hospital system and throughout Florida to come up with a COVID response. And so that's kind of the first big moment that made me realize where we were. And now I start to think through it, and there's some key events that happen that divide time a little bit. And they're almost like, textbook examples in a business book or a crisis book about how to respond to problems. And there's really probably 5 of them. There's the testing problem, the surge problem, the masks problem, the schools issue, and now vaccines. I see those as kind of the big dividing points of the COVID pandemic. And then longitudinally along that, you could almost put in treatment and therapeutics, and then research on top of that, because those things have been going on since the beginning of this pandemic as well. So then I start to think about where we've been with COVID and where we are right now. And there's really 4 different versions of what this outbreak has looked like in Florida, both for you down in the South. I follow that closely. Obviously, the late spring outbreak drove numbers for Florida in the south part of Florida, and then summer outbreak drove numbers, for Florida from us. In March, April, and May, kind of that first period of time was a really important time. We realized that COVID was here and we had to have an operational response. We were fortunate, I think, overall in Florida, because compared to New York or to Italy, the case numbers were not nearly as high as what we saw there, and it gave us time to prepare. So, we were having meetings every day. John helped stand up this amazing West Coast data sharing dashboard, which I really do think allowed us to think through things as organizational leaders in a way where resources can be moved across institutions to safely care for patients. If you're at a small community hospital and you've got 1 12-bed ICU, 6 COVID patients, right, is a really big deal. Versus Tampa General, it's not such a huge deal to have those numbers.
Can I just add in? So that's important, and it kind of underscores why we're in Palm Beach. And again, I can't emphasize enough, we're not in Palm Beach because we think there isn't great healthcare being given in Palm Beach. Because I spent 8 years in Palm Beach. I love that. I love the North Palm Beach community very, very much. And I know how great the care is, but community hospitals don't have the resources a Tampa General Hospital has. That's just a matter of fact. It doesn't make them better or worse. They don't have enough resources. So what we realized on the entire West Coast, you won't know this, but we're a level 1 trauma center. We're the only level 1 trauma center on the entire West Coast of Florida. So we basically take care of the entire West Coast of this state, the 3rd largest state in the country. So we quickly realized that if we can't be there for community hospitals that can quickly get overwhelmed by COVID, people are going to die. And so we quickly put together a consortium of over 50 hospitals where we shared data, and in some cases where we could, shared resources and came to each other's aid when a hospital got in trouble. It is no different than last week, Channel 10 did a report on a cancer patient who was desperately trying to find a vaccine, could not find a vaccine in South Florida. She was a patient of Abe Schwartzberg, who runs the cancer centers of South Florida. And because of Abe's relationship with us, meaning we own Abe's practice, Abe has vaccine. So this cancer patient who needed the shot, who couldn't get the vaccine, was able to get the vaccine in Abe's office because she met criteria and because Abe was part of the Tampa General Hospital network. She wouldn't have gotten the vaccine if that didn't exist. And again, we're not really in Palm Beach to compete with like the local community institutions. We're there to complement what already exists. And that's a real example of the power of a collaborative effort like we're doing here. So just want to crystallize that for people, because that's somebody who desperately needed it and got it because of the Tampa General CCSF relationship. And we're vaccinating, I think, about 50 patients a week in Abe's practice. And you have to meet criteria. In this case, you have to be a cancer patient or have severe comorbidities. But we're able to do that because of the relationship. Sorry, Jason, go ahead.
John, you don't overstate it. I mean, the ability to share information and share resources quickly, during a global pandemic is just a key part of being able to respond to needs that are different every day for different hospitals. And if you look at high fatality rates from this pandemic, it's when hospitals get overwhelmed. And so we knew we wanted to give the best care to every patient every time, not just for the patient who happens to be at Tampa General today, but for every patient in Florida who is presenting with COVID. And that's the only way to do it. So it was a big decision. It was an important decision. Another important decision at that time, if you can think back to the spring, was a decision we made to stand up our own testing. And that became another huge thing that I think really drove our local county, at least, response and ability to get a hold of where we were with COVID very early on. Because, if you remember the spring, people in New York, they thought they may have COVID, but they couldn't get testing. So they weren't sure. They were managing the best they could. But we started, testing not only at Tampa General, but really in a number of partners throughout the community to really get a sense of what this virus looked like right now in the county and how can we start getting people into the hospital safely. And if they're going to come past the emergency department, how do we get them through the hospital flow and throughput safely as well? This is all during the time, if you remember, during the executive order to halt elective surgeries. And so it gave us a little bit of time to prepare and to really make the hospital safe. And that's really what I think now, when I think back on March, April, and May, is about, you read these textbooks about how teams come together. That's what was happening during that period of time. You had emergency medicine doctors working with ICU doctors, working with infectious disease doctors, plus hospital leadership, maybe for the first time ever on a daily basis. So the team was gelling, right? All those things. It was really coming together. We were setting up testing. We were building this West Coast Florida data dashboard. And then we were also learning how to take care of patients with each other. And I'll tell you, actually, as a physician, that was one of the most gratifying, if there was going to be a gratifying part about a tragedy, that was the gratifying part, was that I was reading journal articles with our chair of trauma. Because he runs a large ICU as well, and we're this is something we imagine we're going to do as physicians, but the reality of life is that you're not always sitting around reading journal articles, right? In the reality of the day, but that's actually what we were doing, and we were working together to come up with the best treatment strategies. So case numbers, even in the South, compared to where we were going to go, were relatively low during that period of time. And we were able to get those processes stood up and really practice and come together so that when we saw June, July, and August roll around, we could be ready. And, there's really another, so I talked about that day in March with the infectious disease doctor, setting up our own testing around March 13th and our first cases during that period of time. And then we kind of entered that period of getting ready and low case numbers. But then June comes and we see a surge, and we see a very serious surge that we were very prepared for. And I think overall the state did a good job of preparing for it because we had that lead time. So in June, and it's another one of those memories, June 19th, it's a Friday, I'm leading my summer symposium with my undergrad, with my pre-medical and medical research students. And I come in to talk to Dave Ween, who's our chair of the department, and he's not sitting at his desk. And I say to the resident, where is David? Is he in a patient room? No, he's downstairs. And I think to myself, downstairs? Downstairs is where we've got the tents set up. Downstairs is where we've built an alternate care site. Downstairs, and for those of you who haven't seen Tampa General, it was fairly cleverly built in one of the weirdest places. So it's sitting on an island in a flood zone, like in a hurricane zone. So probably not where you'd plan to build a hospital, but there's a lot of history as to why the hospital sits there from the early 1900s and 1920s, and that's where it's at. But when the new emergency department got built in the late 2000s, it was actually built way above the floodplain for all the hurricanes. And so it's actually very safe to get there. But underneath where it could flood, we use that as a valet parking area and also a disaster response area. So this disaster response area is really well built out. It's got triage areas, showers to decontaminate people. We drill in that area every year. We do a big county-wide drill and we practice in that area. But over 12 years, I had never actually used that area in a real go time for a real event. And so we had built in an alternate care site, meaning tents and spaces to see a surge of COVID patients. And, this resident says, oh, David's downstairs. And I go down there, I open the door, and it's June in Florida summer. I open the door and this, 100-degree heat wave, hits my head, and it's, humid. But I look out and there are rows of socially distanced chairs of people who've presented for testing. And both of our tents are, going full speed with our providers who've been just amazing, being asked to go somewhere different to treat patients every day, and they're full PPE, in the hot area, seeing patients and screening and treating as many patients as possible. And we saw over 310 patients in an alternate care site that day. And it was really a shift in where we were with COVID. And just to give you an idea, not to get too into the numbers, but we see on a normal day in the ER, busy level 1 trauma center ER, we see about 270 patients a day. So we saw more than double the volume outside in a alternate care site area just for COVID that afternoon. And really starting around that part of June, we went through a month-long period where things were like that every day. The positivity rates over 20% for the people who came in to get tested for COVID. And so we're again having to come up with new ideas to recreate space in the hospital system. And you see this throughout the entire state of how to kind of reimagine why a patient needs to have a hospital bed versus maybe that same care can take place somewhere else. Maybe it can take place at home using biotechnology. Maybe we can start using telemedicine in our Big Links, our academic medical center, to see patients in a telemedicine setting as well. And so we start to do all of that, and we start to do it really well, actually, where we can get people home safely, monitor them 24 hours a day, do things we never really imagined doing in emergency medicine before a pandemic came and kind of forced our hand, but I think forced it in an interesting way to really reconsider who needs to be in a hospital bed, when, and why. And so that was June.
So Jason, can I add in just a little
Please,
bit
John.
of color? So when Jason talks about our institution, because we do get a lot of patients, quite frankly, right now from Palm Beach coming over to our institution for care. We're about 3 million square feet on 25 acres. We're gigantic. We're over 1,000 bed facility, and we're on our way to being about a 1,200 bed facility. And again, tertiary and quaternary care is really our focus. One of the things that Jason and his colleagues did is we stood up this. I believe that it's the state's first and only Global Emerging Diseases Institute. What we quickly realized was we're going to be dealing with COVID for a while. We're also probably going to be dealing with other infectious diseases, and we don't want to be caught flat-footed if other infectious diseases start coming our way, or if COVID starts to mutate in ways that we need to be prepared. So we built we took an existing freestanding building and we turned it into the Global Emerging Diseases Institute. It's actually called, because we got a pretty significant donation, it's called the Tanasia Family Global Emerging Diseases Institute. It's a mouthful. Inside the walls of our institution and our health system, it's called JEDI for short. We love acronyms in healthcare, and JEDI seem to fit perfectly. But that's basically 60 beds for critically ill patients, another 30 beds for overflow. We also have outpatient space, surge capacity. We're building research space, educational space, physician meeting space. So basically in one facility, we're going to become the leaders in this state for global emerging diseases. So we're going to stay way ahead of anything that is out there. And we're going to investigate and explore new approaches to care, new research, new vaccines. We will have collaboration with big pharma, and that is a center that can be leveraged and used across the state of Florida. Because institutions like ourselves need to make our resources available to a state, to the whole population of the state, because of the type of institution we are. So under Jason's leadership with so many other people, the things that we've learned, we are extrapolating across our enterprise and really starting to share that with people across the state so we can continue to improve on how we deliver care for infectious disease patients, and in this case, obviously, COVID-19 patients. And so that's the tie-in to all of this. You know, we're in a global community, and if you didn't think we were all interconnected before COVID, to after COVID, it shows you how interconnected we are as a global community. So a state like Florida needs to think more broadly. Number one, because we're such a big state, and number two, we're so interconnected. And that's some of the work that we're doing as an institution. Now, it sounds a little bit esoteric, I'm sure, to some, but it's not when you come through the doorway of a TGH facility, whether you're on the East Coast or here, and when you get world-class healthcare that is tightly coordinated, tightly managed, driven by clinical pathways. I mean, if you look at our mortality rate, and Jason can speak to this, when you look at our outcomes related to COVID patients, we have some of the best outcomes in the country from a recovery perspective with COVID patients. It's because of our doctors, our nurses, our technology, and our infrastructure. I don't know if Jason, I know we're probably getting to the end of our presentation, but if you want to spend a moment on that, and then Noel, we can open this up to questions. I want you to keep us on track, okay?
Yeah, absolutely, John. And just to kind of move past June, July, and August, we get out of this big surging pandemic because we are so interconnected. We realized we had to really make an effort to get people to follow public health measures. And John helped do that. The hospital helped do that. And it was very successful. We stabilized our area's numbers. People started to wear masks more often. People started to stay out of crowded indoor spaces. And we saw our numbers level off. And then September, October, November, that's the period of time where I really think about what John was just talking about, where I really think about us taking stock of where is best for each COVID patient again, and then how we start to really get research. We were doing research, but how to really get it ramped up and running. And so by the time we get to October, November, we've got the JEDI open. We're putting patients in the JEDI. We have elective surgeries going safely in the hospital. We have our emergency department divided into really two separate spaces, a COVID emergency department and a non-COVID emergency department. We have a negative pressure unit attached to the emergency department for observation level COVID patients with another 10 beds. And then we have the alternate care site with triggers and thresholds built in to turn it on or turn it off as we need to. So we start to get a really good handle about who goes where. And then, not to mention, we've got another site where we're seeing, because remember, no one in the community during that summer period knew what to do with a positive COVID patient. And so we're seeing all the downstream follow-ups of COVID patients and putting into research trials that are appropriate before we had any drugs to treat people outside of the hospital. Now, in the hospital, we're giving people research medications, monoclonal antibodies, convalescent plasma medications, drugs like remdesivir, steroid medications were on oxygen. And then I think for the frustrating thing, I think for physicians seeing people who are going to go home or as outpatients was up until November, the options were more limited. But our research network was able to get people into clinical trials, at least during that period of time. And then November comes and the FDA issues emergency use authorization for these monoclonal antibodies that you might have heard about. And really Tampa General is driving that process for our entire region because there's some clunkiness to how you have to do those medications for people who are not in the hospital, but you got to get an IV and you got to be monitored. Well, that's where do you do that at? It's not in the hospital. So we were able to kind of stand up an outpatient space in the Jedi for this whole community to help get people that antibody when they're not in the hospital and reduce hospitalizations. So we're doing research every day. We're doing the monoclonal antibodies every day. We have a very full case census of people who are getting a medical treatment, mostly on oxygen, and then requiring more medications in the hospital, and then flowing and seeing patients safely throughout the emergency department. That was September, October, November. We got very good at that. The teams continue to work together really well. And now December, January, of course, we move into vaccines. And December 14th was a huge day because, you know, a truckload of vaccines pulled up to the hospital. And we had a very, and I called in the media, I said, the 15th was like Christmas for me. And the whole atmosphere was very celebratory, I would say, very holiday-esque when I walked in to get my vaccine on the 15th. And, sitting in the, you have to be monitored for 15 minutes after you get your vaccine. So we're sitting in these socially distanced areas in a big auditorium. And I think everybody in that auditorium was feeling a sense of hope, really for the first time. John called it, 20,000 doses of hope, I think, shots of hope, because that's, the number of doses we got. And it was, finally here to see some light at the end of the tunnel. And I think right now where I'm tasked is we still see a surge going on. We still see some danger in terms of the number of cases out there. We see this variant also potentially spreading very quickly. I think the message that I'm trying to get out to people when I go speak in public right now is we are so close to a light at the end of the tunnel. Don't mess it up now, basically. Don't lose a family member now, have somebody get sick right now when we can see that light in the tunnel with vaccines. And of course, Tampa General has been instrumental in getting vaccines throughout our community. So that's my vision now as I look backwards as, over about a year of this, from me really starting March 1st, but these clear breaks now in solving these many crises because we've built this great team and have this great infrastructure at TGH with some longitudinal issues of research and treatment on top of it. So I hope that was helpful, and I'll turn it back over to John or to the team and see if there's questions.
So thank you both very, very much, Dr. Wilson and John, really appreciate it. So as you can imagine, we've got a ton of questions that have been texted to me, that are in the chat, that have been sent through Facebook. So let's start with the first question. And I think this one would go to John, and this is from Rochelle Litt. She is the vice mayor of the city of Palm Beach Gardens. John, I know you know Rochelle. And her question is, do you intend to establish a physical presence in North County other than the established physician offices working with Tampa General?
We do. We absolutely do. But right now, we're aligning ourselves with physicians first. And then as we get critical mass, our plan is to build facilities in Palm Beach, specifically North Palm Beach. That is absolutely our plan. But in order to do that, we need to basically aggregate, consolidate, and partner with existing physicians. One of the things we've chosen not to do, and you won't see this from us, is that a lot of health systems, when they come into places like Palm Beach, and I used to deal with this when I was the CEO over at Jupiter, they would come in and they would bring in a bunch of doctors, and they would say things like, well, we want to bring in the physicians because Palm Beach deserves world-class healthcare and they deserve choices. And so we're going to bring in a bunch of doctors because they're world-class doctors. My argument when I was the CEO of Jupiter was, well, that might be all well and good. I find it kind of interesting and curious that you're not taking those doctors and putting them in Lake Okeechobee, where they really need world-class healthcare. Because in Palm Beach, they don't need to be saved. We have a excellent medical community that exists in Palm Beach today. And I still believe that to this day. And I've been a CEO at Tampa for 3.5 years. What Palm Beach needs is somebody like a Tampa General who recognizes the excellence that exists in Palm Beach, and quite frankly has always existed in Palm Beach, and help support those doctors, help grow those practices, and help fill in the cracks and crevices where there might be a need. So, but in order to do that, Vice Mayor, is you first have to start partnering with the local doctors to create that critical mass to then be able to build larger facilities. And that's essentially what we're doing right now. That is a great question, and that is our strategy. Hopefully that helps.
Great. And our next question comes from Jack Lighton. His question is, do you think the recent new proposals to release the full vaccine stockpiles all at once now to speed up distribution is a good proposal, or do you think it will put the system and public at risk for missing their second vaccine? Who wants to take that one?
I think we both can. Jason, you want to take a swing, and then I'll follow up from you.
Sure. So, first of all, I just state that I recognize there's a lot of urgency around getting this shot into arms, and that urgency is understood. Every day there's a vaccine not in people's arms and on shelves instead, right? That's a day where cases are going to go up and hospitalizations are going to go up and deaths are going to go up. And, I talked through having to solve about 5 or 6 many, crises or challenges during this period of time. And what we've seen is that we have rapidly solved these problems in healthcare at speed you've just never, ever seen before. And, once we've solved it once, we are getting much better at it so we can do it better every day. I think we're seeing the same thing happen with vaccines right now. As we stand up the processes around vaccines, get those hardwired in, have a way to do it, you're going to see vaccine distribution really start to take off and go much more quickly. You got to remember the vaccines are going to hospitals and, departments of health, and then having to move out quickly to other people. And there's just, some building that has to take place to do that. Overall, if you look, it looks like right now there's probably more shots distributed out there than have been given. And so I think overall, anything we can do to help, get shots into arms is the best thing to do. And I'm hoping that a month from now, we look back on this and, say basically everybody who needs to get vaccines been prioritized is able to get vaccine. And we have processes that are happening for all those groups of people. John, you and I talked about this recently, so I know you've got some thoughts too.
Yeah, no, I think Jason, you said it well. Look, I have been involved with the state and the governor in particular from the very beginning. I mean, I was on his Open Florida task force early on in the pandemic to try to gain a better understanding on how to open up the economy safely and responsibly. I think it's a chicken or the egg, Jack. It's an excellent question. If they release all the vaccine, my fear will be is they'll get to the endpoints. So they get to hospitals, they'll get to health departments, they'll get to people that have cold storage. And if there aren't mass vaccination sites that they can bring it to put it into people's arms, they're going to sit in cold storage until people can figure out the last mile, right? Guys, it's no different. You'll all relate to this really well. It's no different when the high-speed train came in from Palm Beach down to Miami, and everybody was excited about it. And it's been my sense is it's been a great success. But what everybody was worried about, and I think people are still struggling with a little bit, is what happens in the last mile. It's great that the fast train gets you from Miami to Palm Beach in 45 minutes, but when you need to get from the stop in Palm Beach to your final destination, what does that last mile look like, right? And what's the logistics around that? The vaccine's no different. What's the last mile? So at Tampa General, and there was a question from Chelsea Reed, and a very good one about, hey, we're ready to go. How does this work? I'll give you an example, a quick example, and I think this can be applied to other counties. Our county, Hillsborough County, has done an extraordinarily good job with collaborating with the health department. And so Tampa General, like other health systems in the region, but Tampa General in particular, We are giving vaccines to our team members. We have given vaccines to 100% of our physicians. We have given vaccines to our physicians' family members. We've given vaccines to our team members' family members. Everyone that meets criteria, you have to meet the criteria, okay? We have not given our boards or our donors preferential treatment like has happened a little bit, I think, in South Florida. We have not done that. We have said to them the same thing we've said to everyone else. If you meet criteria, you can get the vaccine. If you don't meet criteria, you cannot get the vaccine right now. We have supported the health department. The health department, along with the county, is running 5 mass vaccination sites. We are vaccinating roughly 9,000 people a week. We also have created strike teams that are going to be deployed next week, where we will, at the direction of the health department and the county, we will go into retirement communities, not nursing homes or skilled nursing facilities, because CVS and Walgreens should be handling that. But we will go into retirement communities with our mobile cars and vehicles, with our staff, and we will inoculate people in their communities through this mobile deployment of some assets. And the reason there are strike teams is we're not taking like a shotgun approach. We'll be directed on where to go. We'll go into that community, we'll saturate that community, and then we'll move on to the next community as directed. That's basically what we're doing at the moment. I would encourage Chelsea, you and others, to put pressure, and I'm sure you don't need to, because I know Dr. Alonso, and she's a wonderful, wonderful physician and has done a great job for the county. But I'd work with the county and I'd work with the health department, and I would call upon your hospitals to collaborate, because what you're creating is a public-private partnership that leverages the strengths of each individual entity coming together to distribute the vaccine. It's exactly what the governor envisioned. It's what the executive order has outlined. It's now a matter of implementing it. So I'm giving you an example. I think there's lots of probably great ways to do this. This particular way that I just described to you has been very effective for us. It's not perfect. But we don't have vaccines sitting on shelves. I can assure you of that. This stuff is moving out as quickly as we humanly possibly can. And we're following the rules, essentially. And I will tell you, the governor, and this is not a paid advertisement for Ron DeSantis, even though I am a supporter of his, he has done a very good job on the ground. He has supported hospitals, he has supported the health departments, and he has supported, where appropriate, communities when it has come to PPE, vaccinations, and other resources that we have needed. He has done an excellent job. And I will tell you, the fact that the federal government is now saying vaccinate anybody over 65, well, Florida's been ahead of that for a month. He made that decision a month ago, and it was the right decision, because what he basically said is, let's protect the most vulnerable, because that's what this disease is killing, the most vulnerable. So let's get after that. And that's essentially what we're doing. Now, we're also protecting our frontline healthcare workers and our first responders, which is equally as important. And that's essentially what we're doing right now. So I would encourage you, maybe the example that I just laid out for you is something you could bring back to your counties, your health departments, and they could actually call Hillsborough County. They could call the health department in Hillsborough County, and they could share information and learn from each other. That kind of collaboration and free-flowing communication is critically important in a crisis. So hopefully that helps a little bit on how we're handling it over here. And not to beat this completely to death, but our practices over on the East Coast, it's very interesting. We had a long debate about that. Should we be moving vaccine over to the East Coast? And what we ultimately decided the right thing to do was to do that, because those are our practices, they're our patients, and we have an obligation to support, I would argue, some of the most vulnerable people in the community, the cancer patient. And the fact that this cancer patient, the one I gave you an example of, couldn't find a vaccine anywhere is beyond me. And she's a cancer patient, and the likelihood of her getting COVID-19 and getting severely sick from it and potentially dying from it, I mean, Jason, you could tell me it's probably 20, 30, 40% greater than someone with no comorbidities, not fighting cancer. I mean, I would imagine. So we're moving as much vaccine as we can over to our facilities on the East Coast because we see that as an extension of who we are. And quite frankly, we're obligated to do that, in my opinion, based on the executive order from the governor of the state. But that's some of the, hopefully that might sharing that experience with you and our approach can help some of you working, locally in your markets. You want to add anything, Jason, before we move on?
No, I think the points are all well taken, and you hit on it a little bit, John. I'll just say again too, the vaccination of people over the 65 in this area, I think, has been really important for Florida. These are the most vulnerable people overall that we have, and we're trying to reduce mortality, and that was the strategy, and it's a strategy, and that's the strategy that was picked.
Thank you, John. Thank you for addressing Chelsea's question. We have, as you can imagine, some more vaccine questions. Let's talk about children and kids.
Sure.
When do you anticipate we will see a vaccine for children? Lizette Milan is asking.
Yeah, that's a great question. One of the funny, weird things about clinical trials in general is they tend to leave out pregnant people and children. They're considered, vulnerable populations, and children's physiology tends to work a little bit different. But I want to say one thing about pregnant women too, while we're on the subject, is that we don't see any harm these vaccines that are out right now would cause pregnant women. And so the American College of Gynecology does recommend that pregnant women can consider the vaccine when it's their time, based on the other recommendations, for when to get vaccines. So I just want to at least put that out there. We don't see any harm there in pregnant women. Now, kids are a little bit different, right? Because they're smaller, their physiology may work a little bit different. So they have to have their own clinical trials. Those have started. So Moderna and Pfizer have begun to enroll children into the clinical trials. We saw how quickly the clinical trials went for adults. One of the unfortunate things right now is that there's a very high prevalence of disease, meaning lots of people have COVID right now. And so it's not hard to get the numbers you need to demonstrate the vaccines work. And so that's ongoing right now. And so, I would think, in the upcoming months, we will start to see vaccine available for children as well.
Great, thank you. So we have a question from Aphrodite Mullis. I hope I said that right, Aphrodite. I'm sorry. There are numerous vaccines that are being given. Some people are getting symptoms from the shot, others are not. Is there an insight as to which vaccine had better results? Also, I heard that there may be one vaccine option being rolled out. Is there a time frame for that one that you are aware of?
Yeah, so there's two vaccines available right now. There's the Pfizer vaccine and the Moderna vaccine. They're really similar types of vaccines. They work with a technology called messenger RNA. They both require 2 shots because that's how they were studied. They required 2 shots because that's the way the studies were done. And that's what got them both to about 95% efficacy. And what that means basically is that if you get the vaccine, you're not going to get sick from COVID. We don't know if it means you won't get COVID at all, but we know you're not going to get sick from COVID. And that's what really counts at the end of the day. And so either of those 2 vaccines will get you there. The Moderna vaccine, you got about 28 days between doses, and the Pfizer vaccine, you got about 21 days between doses. Now, the other vaccines that may be coming out soon are one by Johnson & Johnson, which works a little bit differently, and then one by AstraZeneca, which works a little bit differently as well. Those don't require as much cold storage issues, and they're both one shot. And so we don't know what the Johnson & Johnson data looks like because it hasn't been released yet. We do know a little bit about the AstraZeneca data, but it's only released over in Europe right now, not here. So right now we know the Moderna and Pfizer one, whichever one you get, I think is probably fine. We'll have to see what the Johnson & Johnson data look like. And if it looks good, I would imagine that one would be available within the next month or so to take as well.
Great. We've got a question for John. This comes from, she's got a couple questions. Andrea Abramowitz. Golly, I'm having a tough time with these last names today, but I can't get the vaccine for my mom, who's 85 years old and is a cancer survivor. John, what do you suggest she does?
That's a great question. Where does she live? What's county?
I'm assuming she lives here in Palm Beach. She lives in Jupiter, so she's here in Palm Beach County.
So the first thing that I would do is one of the requests, or not requests, but part of the executive order from the governor talked about hospitals should vaccinate their own patients, so their clinic patients, the patients that their primary care doctors see. They should vaccinate people that are over 65 or people that are over 65 that are medically vulnerable, or patients that might be under 65 that have a severe comorbidity. And we use the CDC guidelines for severe comorbidities. So it sounds like your mother fits into one of those, into that big space, that category. So she's clearly eligible. The first thing that I would do if I was your mom or you is I would call the hospitals, the local hospitals, and ask them, are you rolling out vaccines for patients of your particular health system? Okay, they should be aware of that. They should be able to tell you yes or no. If someone did that to us, what we would do is if they were a patient, we'd vaccinate them. If they weren't a patient, we would make them a patient and we would vaccinate them. Or we would refer them to the health department and they would get plugged into one of the mass vaccination sites we have. That's what I would attempt to do. Now, if your mother is a cancer patient or has one of those severe comorbidities, I would work with your mother's oncologist or specialist and figure out where they could go, whether it's a hospital in Palm Beach or whether it's a hospital in Broward or in Miami. I would move around and try to find that, to try to find that vaccine is how I would handle it. And that's what people are doing here in our communities as well. They are. I mean, our patients in our practices are being called just because we've got the infrastructure to do that, and are being vaccinated. So that's kind of how I would handle it. It's not going to be easy, but like I've said, and not to beat it to death, there are some wonderful institutions in the county. I would imagine, I obviously can't speak for them, but I would imagine that they're vaccinating patients. I mean, I would be surprised if they weren't. I really would.
Great. So thank you so much. So I want to be very respectful of everyone's time. So Jason, we cannot thank you enough for spending some time with us today to really discuss what is a hot topic right now and everybody's talking about. So thank you so much for everything that you do. Thank you so much for your support. John, you have something else you want to add?
Can I add one thing, Noel? I try to do this with every presentation I give. And this is this is not political. This is just good preventative measures. Please wear a mask. I mean, like your business owners, your leaders of businesses, your pillars of your community, masks should not be political. They work. There's a plethora of peer-reviewed science that supports it. And I would tell you that body of evidence dwarfs the body of evidence that says masks don't work. Wear masks. Make good decisions around social distancing. Doesn't mean you can't be together. It just means you need to be smart about it. Make smart decisions around large crowds. Emphasize to your teams. You know, it doesn't mean you can't be in a crowd. Just make good, logical, smart decisions. And then, of course, hygiene in general, but hand hygiene in particular. Those mitigation efforts, and Dr. Wilson will tell you, in a lot of cases, they're even more effective than the vaccine itself if you do them well. And we've seen it. We've seen it in our own walls of our own institution. We have very, very, very little spread, if at all, in our institution or anywhere in our system. Why? Because everybody wears a mask, washes their hands like crazy, socially distance, and we make good decisions around crowds. I like to part that onto people just as a gentle reminder. I know how divisive this has been, and that's just plain unfortunate. But please just think about that, drive that home with your employees and the people that look up to you. And I know it can be tough, and I know it can be a little dicey, but you got to continue to lead from the front. A shout out to Chelsea Reed and others who are elected officials really carrying that torch. Don't stop. Lean into this. You're doing the right thing. Thank you. And it's been a real pleasure and honor to be part of this conversation today. And it's a real honor to be a member again of this world-class chamber. I love Palm Beach, and it's nice to be back.
Well, welcome back. We're excited to have you back, John. It's so great to see you, Dr. Wilson. Can't thank you enough for taking the time to speak to us today. Before we go, I wouldn't do my job if I didn't tell you about our upcoming chamber events. So this Friday at 12:15, we're going to be hosting our annual Woman of the Year luncheon. You can buy a virtual ticket for this event by going to the chamber's website. You don't want to miss this amazing event. A week from today, we're going to be having our annual State of the County breakfast with Palm Beach County Commissioners Maria Marino and Mac Bernard. And we also have our Palm Beach County Administrator, Virginia Baker, will be there. This event is going to be virtual. It's going to be filmed live at the Palm Beach County Commission Chamber, so you definitely don't want to miss it. Tune in at 8 a.m. next Wednesday to see it. And finally, the 36th annual Article Arts Festival presented by the Hanley Foundation will be taking place on February 13th and 14th in its new home in the city of Palm Beach Gardens. We're very, very excited to be going there. Special thanks to John and his team at Tampa General for being our health and safety sponsor for this year's event. We still have some sponsorships available and are currently looking for more volunteers. So if you're interested, please go to the Artie Girl website to sign up. Thanks again to Mr. John Couris, Dr. Wilson, and the team at Tampa General for all you do and for this very, very informative seminar. Have a great afternoon, everyone, and we hope to see you all soon.
Thank you. Thanks, Jason. Have a great day, everybody.